Hi, I'm Sandy and this is Lydia, and we are both bladder cancer survivors who have two different kinds of continent diversions. I have an Indiana pouch.
And I have a neobladder.
Lydia, can you tell us what a continent urinary diversion is?
Sure. So a continent diversion is a pouch made from a piece of your intestine. They're placed inside your body where your bladder used to be. They hold your urine until you're ready to empty them. We're going to tell you why we chose the one we have and how they work.
Great. It's going to be a lot of fun.
Okay.
So I was originally diagnosed in 2015. I had 2 rounds of BCG. My bladder cancer was high grade, non-muscle invasive. So 2 rounds of BCG seemed to work, and I was clear for 7 years. Hit the 5-year mark, thought, okay, we're good to go. Got to 7 years, not so much. The cancer was more aggressive. It was then micropapillary. So my doctor and a second opinion both said we needed to go to radical cystectomy immediately, which we did. So my very angry bladder went away through the RC, and I chose the Indiana pouch. And we'll talk more about that later. So Lydia, tell us about when you were diagnosed.
I was diagnosed in 2015 as well, and I was diagnosed with a TURBT, which is the biopsy. And the diagnosis was T1, stage 1, high grade, non-muscle invasive, but I did have, it was multifocal, which means many tumor, and tumor greater than 3 centimeter. And the reason those 2 factors became important is they're 2 of a few factors that are considered high risk for progression. So my surgeon recommended bladder removal at stage 1. I did get 2 other opinions with 2 other centers, but did return to him. My concern was the progression, potential for progression, and if it did progress to potentially stage 2, I would need chemo. And I feared chemo more than I feared surgery because I knew that I would heal from surgery, but chemo can leave some lasting side effects.
Great, thanks for sharing that.